Hi everyone, welcome to the lecture on documentation part 1 dental records. I am Dr. Fawaz Siddiqui from Penang International Dental College. In today's topic, we are going to look at the significance of documentation, which essentially means your medical records, dental records, and your interpretation of lab investigations, x-rays. We will also look at the understanding of dental records and its contents, and lastly, we're going to look at how to manage and maintain dental records. Okay. To get the basic definitions straight, medical record or a dental record is a documented information about dental health of an identifiable individual recorded by a practitioner or other healthcare professional, either personally by the patient or at the patient's request. And this is an essential component of patient care because it contains information about the patient, and it also contains the physician's opinion, that means his diagnosis, and clinical judgment, that means why he has planned a particular treatment, that means treatment planning, which bears the consequences on the patient's future clinical management. Okay. All right. So essentially, when you're writing a medical record, we have to write smart and not more. That means our words has to be very limited. Our sentences has to be very concise, and we only include the relevant information. So that is what is smart. Okay. So don't try to write a lot of things which would not make so much sense. So there are five principles which will guide you in writing a good medical record or a dental record, and these five things are something that you must include in your documentation. Okay, so let's dive in and look at every one of these individually. So first one is record risk benefit analysis of important decisions. All right, for example, if you are recommending a root canal treatment for a particular tooth, then you need to record the benefit of doing the root canal. Okay, it may be that tooth can be used as an abutment for a bridge. That tooth can be saved because it has adequate bony support. All right. The tooth can be used as an abutment for a cast partial denture. So this benefit you have to state. So why are you trying to do a root canal? What benefit are you going to have? Maybe just retention of the teeth or better masticatory functions. You have to write it down, and then you also have to write down the possible risk in this particular treatment or the side effects. So you have to write down there is a complication, there is a side effect of post-op flare up, there is a complication of breakage of file in the canal, right? There is a chance of root canal failure also. So these all has to be recorded. The risk benefit analysis has to be written down in black and white. This is important because it helps to portray that you have taken a well balanced and a reasoned decision for the management of the patient, and anybody who's reading clinical records would immediately understand that your decision has been very well thought of. Okay, it's not a random decision that you took, it is a very well thought of, particularly if this patient goes into a litigation and the judge asks you why did you do a root canal in the first place. So this risk benefit analysis would come to your rescue, and especially if your clinical notes is read by an auditor or a layperson like a lawyer in terms of medical terminology, they should be able to understand that you took a balanced and a reasoned decision. Your decision was not random. Okay, so don't forget to record risk benefit analysis of important decision. Okay, number two is you have to record the clinical judgment used at critical decision points. Okay, so the clinical judgment is basically assessment of the clinical situation. That means your examination of the patient, and then you come to a diagnosis and your response to that diagnosis. Okay, so your clinical assessment of the situation and your response should match. Okay, so if you see in the example that I have put up here, let me get the pointer going for you. Okay, so the example I have given, if you write in your case sheet, the patient, okay, so if you find something like this written in the record, patient had acute episode of Ludwig's angina, prescribed analgesic. Okay, so it shows that you have taken a very poor clinical judgment. Okay, Ludwig's angina, life-threatening situation, complication, immediate complication is airway obstruction, needs hospitalization, needs to have antibiotics, and then later analgesic. Okay, so if you look at this statement, it does not match your clinical assessment, that is Ludwig angina, your diagnosis, and your treatment, your response by analgesic. So you have to record this properly. All right, so your diagnosis has to match with your treatment plan. Okay, now clinical judgment is based on objective and subjective clinician factors that emerge from actual encounter of the patient. That means you have to keep your eyes open, your ears open, and then you have to examine properly, look for signs, look for symptoms, and then you have to make a clinical judgment. You cannot make a clinical judgment just looking at an x-ray and you make a clinical judgment. No, you need to look at the patient in person. That means the actual patient you need to examine. All right, then you will come to a clinical judgment. So don't jump just looking at an x-ray and decide what needs to be done. Something called as primacy of an on-site observer is there, which helps to protect you, and this particular principle is used to determine whether the standard of care was met, and the benefit of doubt goes to the individual who was on the scene at the time, since that individual had access to data, to details and subjective clinical data which may not have been recorded. So being the person present at that particular moment when you were making a clinical decision, right, the patient may not have given you a complete case history, or the patient may not be conscious to give you any case history. So you took the best possible decision based on your clinical judgment. That means your examination of the patient, what you saw, what you heard, and then you took a decision. Okay, so if in the court of law you will not be held responsible because you were there, and the primacy of the on-site observer principle will protect you, but later you must document it, otherwise this benefit goes away. All right, for example, the patient comes in your clinic in an emergency state. Okay, life-threatening situation, you do an emergency extraction, and then you refer the patient to the hospital for further management. Okay, so you do not record this anywhere, you do not record this clinical judgment, why you had to do the extraction. Okay, what was the diagnosis, what is the future plan for this particular patient. If you don't write it, and if the patient goes to the hospital and he dies, god forbid, and a litigation is started, they will come down to you asking you why did you do the extraction, and then you will tell them verbally, I had to do this because of this, but you do not have it written down anywhere. Okay, so you will be held responsible. So ensure you record your clinical judgment. Third one principle is record the patient's capacity to participate in his or her own care. Okay, so the question you need to ask is, does the patient understand the purpose of the various medications that you have prescribed, or the operative procedure that you are suggesting, the root canal you are suggesting? Does the patient understand what is the root canal? What is the complication of the root canal? Does he understand that? It is very important for us to record this. And does the patient understand when the condition is getting bad, or the condition is getting exacerbating? Okay, the clinical disease is escalating. So does the patient is the patient able to recognize this condition? And things like, does the patient know what would constitute an emergency, and if he has to seek help, where he has to call and where he has to go? So this all has to be recorded, and the record of the above responses makes the patient responsible for monitoring their condition. Okay, so it is very important that you have to record that the patient understands, for example, the risk of root canal treatment and the benefits of the root canal treatment in case there is a swelling, post-op swelling of the first. Okay, the patient understand there may be a swelling and he has to call in the office and come within 24 hours. So things like this you have to write it down. Okay, so the onus goes to the patient to monitor his or her condition. So in spite of writing all this in the record, the patient does not follow your instructions and something bad happens to the patient, okay, you will not be held responsible in the court of law straight away, because you have documented that the patient was in the capacity to understand and he was told what to do in case of an emergency. Okay, so this record you must. The fourth one is record using tactful tone and objective language. So these are the words that you're going to use when you're writing your clinical notes. So the audience for your records may not be medical professionals. Okay, so they may be people, they may be lawyers. Okay, they may be people from the insurance company who are trying to figure out whether you did the right treatment or you did not do the right treatment. Or they could be from quality assurance reviewers when you're going in for the standardization, ISO standardization, things like that. So your language has to be simple and straightforward, not so confusing. So it has to be professional, clear, objective, avoid any cryptic communication styles. Cryptic communication style means secret communication styles. Okay, so sometimes in the record we write some abbreviations or some cryptic writing, so that next time we do not actually want to write what happened, but we do write something which will indicate to you that this was the situation last time. Okay, so don't do that. So especially for example, when you're using a tactful tone, an example that I have put in is, don't write something like the patient has referred to Dr. Google. That means the patient has searched Google, and from his search, he is unhappy with your treatment and he's creating a scene. So don't write a referral, and the reason for the referral you write as a patient has referred to Dr. Google and he's creating a scene. Please take care. Okay. If you write this in the patient's referral, this is considered as a negative remark. Okay, and you will be held responsible. So how do you deal with this? You write more tactfully. So the patient, you can write, the patient is very concerned about the dental treatment received and I'm referring for a second opinion. So this is a very tactful tone of telling the other person why the referral is coming. Okay. So no sarcasm in your writing, no demeaning terminologies to be used, no attempted jokings, not even a casual tone. So this has to be strictly professional tone in your writing. So whether you're writing a referral or you're writing your own clinical notes, you have to ensure all this. If the clinician's writing on a document gives a negative tone, it is considered unprofessional care and you will be immediately held responsible for your writing. Okay, they will immediately say this is an unprofessional care provided, and then of course you will be sued immediately. So use only standard abbreviations and short forms. Don't use any cryptic short forms. Okay, so use whatever is accepted in your dental practice, in your country, in terms of LA. So we say LA is understood as local anesthesia, right? So try to avoid abbreviations, but if you use, try to use the very standard ones. Now, the document should also include the clinicians or the medical staff name and the discipline for identification. All right, so it's very important that you sign your medical records and you have to write your name and your designation there. Then the last one is the record using principle of transparency. The principle of transparency refers to the quality of documentation whereby the original and the correction or the addition are both clearly marked so that the viewers know when the original was written and when the corrections or additions were made, and no attempt is made to mislead the reader or to fudge the record contents. Okay, so it will happen in your clinical practice that you written your records and for some reason you did not record the medical history. Okay, and something bad happens, so there you want to make an addition to the record, you can make an addition to the record. Okay, don't change the record. Okay, if you try to change the record, it will be unprofessional and unethical, and you will again, if caught, will be held responsible in the court of law. So if any correction or addition of missed important piece of information you do, it's a good thing. Okay, so don't feel that it's a bad thing, because it shows that clinician is reading his or her own chart and that he or she understands what is clinically significant by recognizing relevance of omission and consequently recording it in the record. So it shows that you are alert. Okay, mishaps will happen. The question is, how have you handled the mishaps? Okay, so if you break a file in the patient, okay, you have to make a note of it. Okay, now do not scratch away the whole RCT treatment because you have broken a file and try to fudge the record so that nobody will come to know that you have done the RCT. Okay, don't do that. The file is broken, you write the file is been broken, and then you write what has been done about it. So be transparent, especially when you're making corrections or additions in your records. It's okay to do additions and omissions. So when correcting a pre-existing entry, what you need to do is you have to begin with a new entry, write the current date, write the current time and then describe the correction. So don't feel shy if you want to make a correction. Okay, so the example is you write the current date and time, and then you can write something like review of previous extraction entry reveals that medical history was missed. Omission of this had caused allergic reaction to penicillin. So it's okay. It shows that you had been vigilant to identify the cause of the problem, and then future problem will automatically be stopped. So if the patient goes into litigation and you say that yes, it was missed, but I had recorded it later and I took reasonable uh, uh, standard of care to control the allergic reaction, to manage the allergic reaction, and this is it, so less likely you'll get into the trouble. Okay, but if you do not write this part, the court will say, oh, you never went back, you never reconsidered what had happened, you never looked back, so this is negligence, and then you will be of course penalized. Okay, so for any clerical errors or typo errors or spelling mistakes or wrong terms, just draw a simple line through the error, just strike it off with one clean line and write the correction out in the margin so that it does not block the existing entry. Okay, so don't try to use whitener, don't try to use uh, scratch out any mistakes, just put a line through and write the correction in the side. And then when you do that, the correction has to be dated and initial. That means we know that who made that change. Okay, so many times you will have one of your colleagues writing something wrong, so just correct it and put an initial there, of course when you are the senior. Okay, so corrections can be made, but there is a method of doing the correction. If you scratch out anything, it indicates that you are trying to erase a record, and then you will be caught and held responsible if something bad happens, god forbid. All right, so those were the five principles of writing good documentation, things that must be included. Now let's look at five significances of documentation. Why is documentation is so important? So number one is it's a mode of communication with other healthcare professionals. Okay, this is especially true when there is a transition of care from one healthcare professional to the other, or the patient is seeking a second opinion and you want to convey the communicate the patient's finding to to the other doctor. So you need to have a good documentation. So basically you need to write what, why, when, and how the clinical care was delivered, and essentially it maintains a continuity and coordination and transition in healthcare management. Okay, now number two is your risk control in malpractice. Okay, now risk control in malpractice means that you can be sued for something that you have done 2 years ago. Okay, because in terms of failures of implants, which will not be immediately known, maybe after a year, and people can still come back and sue you for not putting a not providing adequate dental care using the implant. So your good clinical documentation will become a reminder for the treatment, because you may not remember what happened 1 year ago, who was this patient, what exactly happened. Okay, so a good clinical documentation is a good reminder. Okay, so it will help you protect, and your document will be considered as evidence of breach or deviation from standard of care. So that means the documentation can be shown in the court of law to prove that you did not provide standard care or you provided standard care. So that is why you have to have a good documentation. So it's a risk control in malpractice litigation. And okay, so number three is quality assurance. You have to have a good record keeping practices, and you need to perform clinical audits to ensure that your record keeping practices are standardized to the national standards or the international standards. Okay, so this helps keep the quality of your records maintained. Okay, and in effect it reduces errors and surgical or medical mishaps. Okay, so once we start scratching out, if you see in your medical record there's a lot of scratching out in your clinical audit, you have to correct it, and so once you correct it, you will automatically bring your record keeping practice to a higher level or higher standard of record keeping. And then in the future, if you have any litigation, the improvement is already there. Okay, and less likely of having error. Most of these errors will come when you are extracting a tooth. Okay, so you are extracting 4/6, you extract 3/6. Okay, then you scratch out 3/6 to write 4/6. Right, and those kind of errors will go away when you are ensuring the quality is there. So that means there is a standardization. Okay, so this is quality assurance. Then the fourth one is reimbursement and insurance claims. So especially when you patients are having insurance and the third party is paying for their dental treatment, A good dental record is normally asked by the insurance company to see whether you have provided the appropriate care or not. Okay, so the patient has an insurance for restoration, and then you have put an implant and you are trying to sneak in implant into the restoration to get the money from the patient. Okay, so these kind of things, insurance companies are very vigilant. They will ask for the clinical records of the treatment done, so this helps them to process the claim. Okay, and this helps the patient also to get the claim processed faster, because your records are standardized, there are very good standards, very good quality, and the insurance company will have more trust in you, and they will be very happy to process claims coming from your office. Lastly, we need to have good documentation because we need to maintain the treatment planning of the patient, okay, on the long term. So basically, a good documentation tells the patient's story, okay, signs and symptoms, medical history, dental history. So all this is like a story, and then your plan and evaluation of the patient's treatment in the long term is very essential when you talk about a patient who is undergoing treatment for, say, squamous cell carcinoma. So how he presented to you, how he was after the surgery, how he was after 1 week of surgery, after 1 year of surgery, after 5 years of surgery. So your document will show all the patient, the whole of the patient story. Okay, and then this becomes a permanent record for the patient's future care. And this is very important. When I say permanent record, is because in terms when there is a natural disaster and people are trying to identify charred body using their dental records, your documentation will provide a very good platform for identifying the deceased. Okay, so we need to maintain good documentation. Okay, so how do we improve documentation? Okay, so number one, we need to make our documents standardized. So when we say standardized, that means we have to follow a established standard. So here in Malaysia, we have something called as medical records and medical reports guideline of the Malaysian Medical Council, and this is the reference number. In 2006 it had come out. So it gives you how to write medical record, what to include, what not to include, what to do, and things like that. Most of the presentation is has been taken up from this guideline of the Malaysian Medical Council. Okay, and then standardization also means it has to be clear, concise communication, understandable by non-healthcare professional. This is coming again and again because your document will be read by people who do not have a medical background. Okay, so your documents has to be standardized in those terms. Then you can have regular quality control checks. All right, and then of course you can have clinical audits on periodic basis, just to ensure that the standards that you are trying to follow, say the guidelines of Malaysian Medical Council, is maintained or not maintained, and if it is not maintained, where is the gap, why is the gap, and that is where the clinical audit comes and helps you out. Okay, and of course for your quality control and quality assurance practices, you have your own audits uh, that will also help improve documentation. So you can identify if you're not maintaining, or people are not signing, the doctors are not signing their clinical notes. Okay, the dates are not available in the clinical notes, things like that. Okay, so this is regular review will help improve documentation. Your friends and peers can also help you in improving your documentation, especially when it comes to standardization and feasibility. It may so happen that, like, we are considering the standards from the medical fraternity, how to convert into dental fraternity. Okay, for dental records, what do we do? So here the peer support will come in. Say Malaysian Dental Association may come in, and they will have a standardized way of, say, for example, writing a written consent, for recording a patient case history, for writing a diagnosis. So they may come out with a standardization, and because it is feasible to your own practice. So here the peer support will come in. And of course, if you are finding trouble how to do things correctly, you are a new dentist who started a new practice, the old practitioners can help you troubleshoot the problems you are facing, and they can also advise you. So that is also a way of improving your documentation. You just have to ask your older experienced colleagues. And finally, you can have continued education courses, which can be done locally or nationally or international dental association. You can also have attend courses from dental protection units and professional insurance companies. They also have their professional not professional, they have their continued dental education programs, where they try to make the dentist aware of what has to be recorded, how it has to be recorded, what are the best practices currently going on to increase your documentation, the quality of documentation. Okay, right. So that was for the learning objective 1. For learning objective 2, where we had to look at dental records and understand its contents. Um, in your dental records, there should be efficient record keeping to ensure comprehensive and accurate information is recorded, and this has to be updated regularly. Okay, so the medical condition of the patient changes has to be recorded. Okay, dental condition of the patient has changed, has to be recorded. So this has to be efficient record keeping, and comprehensive and accurate. And there should be a record of patients every visit to the clinic, right? So even the patient comes for a checkup, you have to document it, you have to write a clinical record, clinical note. I would say if the patient misses an appointment, okay, for some reason, that also you must write into the patient's records. Okay, the patient was unable to attend his appointment today because of something, 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 and then you sign it. Okay, in case you are doing a root canal and the patient keeps missing his appointment, after 5 missed appointments, the patient comes back to you with a vertical fracture of the root. The patient will try to sue you that you have not done the root canal properly. So these records will show the judge, okay, in the court of law, that the patient missed 5 appointments, right? And then the crown broke, and the crown broke because of the risk of root canal treatment, which we have already recorded when we were doing, can you remember, the risk benefit analysis when you're recording that? So that is done. So you are safe. The patient cannot do anything for you, cannot harm you. So that is why recording of patients every visit or every missed appointment is very, very important. And the dental records will consist of individual records and it will consist of clinical records. Okay, so let's see what are the individual records. Now, these individual records must include these and more. Okay, these are essential. Must include medical history, must include full dental charting. Okay, that means your IC-DAS, your periodontal depths, all that has to be recorded. Risk habits, tobacco use, alcohol, periodontal status, like we already said in the charting, if you do not chart it separately. Soft tissue examination, and if the patient is wearing any appliances, any dentures, or any uh, you know um, tongue piercing studs or something is there, so you have to record. These are essential, you must record. That is why it says here is not limited to. Okay, so this again I'm pulling it out from policies in the clinical records should be easily retrievable, right? So that means you must know where it is kept, where is it available. So if anybody asks, you must be easily retrievable. Don't ask the patient to come back after 3 days. I'll take out your case file and keep it for you after 3 days. No, cannot. Your clinical records should include x-rays and the results of investigations and study models. Okay, they should include detailed notes of the treatment, which means that if you do an extraction of a particular tooth, you need to write detailed notes. You need to write what block you gave, what LA you gave, how much LA did you give. Okay, the tooth came out easily or it had to be extracted. Was there any fracture of the buccal alveolar plate? Did you do any sutures post op? What medications did you give post op? What complications are you expecting? Okay, what does the patient has to do if the complication occurs? How does the patient reach out to you in case of emergency because of the extraction? This is detailed notes of treatment. Okay, so you must have seen in all these movies where doctors are so stressed out and they're writing the clinical notes and they're tired of writing. They are writing these important notes. For dental also, we must make a habit of writing detailed notes of the treatment. Okay, so for example, if you do an extraction and the patient goes into a cardiac arrest, all right, and the patient puts a court case on you that you did not use the correct medicine to extract the tooth and your medicine has basically caused a cardiac arrest. So the judge will ask for what? Your clinical notes to see whether you have taken balanced and reasoned clinical judgment or not. Number one. Number two, you will see what treatment did you do. Okay, so for some reason the patient had a heart problem and then you have injected something using as adrenaline. Okay, LA using adrenaline, which may be contraindicated, say for example, then remember recording your clinical judgment at critical points and your assessment should be congruent to your response. Remember, yeah, that will be seen first and then they will see the notes. Oh, he has given adrenaline, he missed out, so he was negligent. So that is why the detailed notes has to become. And say if you don't write any notes at all, okay, then definitely you will be caught, because the judge would say that you have been negligent, because there's no record that you have given the right LA or the wrong LA, or whether you gave LA at all or not. Okay, so it is very, very, very important that detailed notes. Okay, remember. Then once you write to detailed notes, it has to be signed. You have to put your name and you have to put a date, right? That seals it on that particular day. So you have to be very careful. There's no two ways about it. You have to be very careful of what you write on the paper. Okay, even after 2 years, you will be held responsible for what you have written 2 years ago. So be very, very careful. Learn to write good clinical case notes. Include treatment decline. If the patient refuses the treatment, you have to make a note of it. Or if there is a non-compliance to treatment or instructions provided, that also you have to put a note on it. Okay, so very, very important. Patient does not want a root canal treatment. Okay, say the patient cannot afford the treatment and the patient requests for extraction. So that has to be put there. Okay, for some reason he goes and sues you that you did extraction, you never told me about RCT. So your clinical notes will tell you that I told you about RCT on this particular day, and you declined it because you said it was too expensive. I have written down everything, I have signed it with time and date. So again, the patient cannot uh, harm you. Okay, and then in the clinical records you have to include a copy of all the referral letters that you have sent out, or the referral letter that you have received for that particular patient. Okay, so it shows the timeline of how things have happened. And of course, it's written last year, but written consent is utmost important. Must have a written consent. And written consent is not for a blanket written consent. The written consent is very important. Written consent is for each treatment you provide. So you do one patient has two root canals and one extraction, that means he has to give three consents. Okay, for two root canals separately, for extraction separately. You cannot have a blanket consent. Okay, right. Okay, so that covers our objective, learning objective 2. For the last learning objective, we are going to learn how to manage and maintain dental records. Okay, so in dental records is important because it is can be considered as legally supportive document, all right, in a court hearing. So that is very important. It can be produced as an evidence. And the status of medical and dental records are classified as confidential within healthcare facilities. So no Tom, Dick, and Harry can come to your clinic and open a patient's case file and read. It is confidential, all right. And you can label it as not to be handled by the patient, basically because uh, that information is your intellectual property. We'll see in the next slide. Okay, so even the patient cannot open his case sheet and see at random. So when we talk about manage and maintain dental records, we are talking about retention of dental records, we're talking about security and safekeeping of dental records, we're talking about ownership of dental records, and we're going to see how records are transferred between two facilities. And then we're going to see who has the access to the dental records, what are the patient's rights to access of dental records. Okay, so let's one by one. So retention of dental records essentially tells us how long do you need to keep a dental record and when can you dispose it off. Okay, so for an example, I'm taking here is the policy of General Dental Council in UK. So they say for general adults, okay, you have to keep the records for 8 years after the last contact. Okay, subjected to the understanding that there is no evidence of long-term disability. All right, so if there is a long-term disability, say if you have put an implant, maybe you need to keep it for longer, but for otherwise 8 years from the last contact. After 8 years you can dispose of. They say 8 years is because if any litigation has to come, it has to come within the 8 years. Okay, after 8 years chances of litigations are very poor, so 8 years is maximum. For children, you have to maintain their dental records up to the age when they reach is their 26th birthday. Till that time you have to maintain the child's record. Okay, this is from the last contract. For mental patients, 20 years from cessation of treatment, you have to keep the records. Okay. For clinical trial patients, 15 years from the conclusion of the treatment. And for the patient who have already died, you have to keep the records for 8 years after the death, and then only you can dispose of the records. Okay. So this is from you. From Ministry of Health Malaysia, the the policy is that you have to record it for a period of 7 years from the last date of treatment. Okay. Now, if the patient comes to you every year for some treatment or the other, then you just keep adding seven. Okay. And last he came 7 years ago, and this is the eighth year. He has never come in between. Then you can dispose of his record. So you have to maintain it for 7 years. So many times it happens in the practice that you have a patient who is continuously seeing you. All right. So you have to maintain his record till his death. All right. So that is how. And patients who discontinue the treatment after 7 years, they have not come to you within those 7 years, then you can dispose it off. Okay. For minors, that means for children, okay, you have to retain for 7 years after they reach the age of majority, that is 18 years of age. So basically, for the 25 years, you have to keep the records. Okay. Essentially because children are developing, things are changing, physical growth, dental changes are there. So you have to maintain it for 25 years from the last day of contact. Okay, so that is how you have to retain. Now, regarding the security and the safekeeping, the security of dental record is the responsibility of the person in charge, the clinic in charge, or the chief executive officer, or the medical director of the healthcare facilities. So if anything goes wrong, the litigation will come in his name, right? So he's the person who is responsible. Then it is a responsibility to keep the dental record safe from weather and from vermin. That means it should not be that dental records have washed away in the rain or washed away in the flood. So you have to take reasonable precaution against it, or it has been eaten up by rats and termites. You have to protect, safe, keep the dental records. So you cannot say to the court, judge, the records are missing because it got washed away in the rain. All right. So you will be held responsible because it was the responsibility to safe keep it for the 7 years. So again, you will be in trouble. So it should be easily accessible and easily retrievable, and must not be taken out of the healthcare facility. You cannot take a patient file out of the healthcare facility. Only time that it can be done is by the court order. And when the court orders, a copy of the record shall be retained by the private healthcare facility. That means you can keep a certified copy, and the original record should be returned to you after the proceedings of the court has been conducted and over with. Okay, so that is why the file should never leave your clinical practice or your hospital. Now, who owns the records? Who is the owner of the records? The medical records are the intellectual property of the medical practitioners who has written it, because he has used his intellectual capacity to make a diagnosis, to do a treatment, to do the follow up, to change medication, to add medication. So basically, the medical records are the property of the medical practitioner and healthcare facilities. Okay, so medical records are not the property of the patient. What is the property of the patient is the results of investigation, the blood test done or imaging done, x-ray done, scan done, that belongs to the patient, and this has can be released to the patient when the patient requests for it. You cannot hold on to it. Okay, and if a third person is asking for the patient's record, then you need to have patient's consent. Okay, to release those records. Okay, so if you have a patient who has reached the age of majority, say 25 years of age, and his parents are asking for his records, then you have to inform, or his physician is asking for his dental records, then you have to inform the patient that your physician has called up, he's asking for your dental records, shall I give it to him? Okay, so this is what is consent. Of course, you have to balance out who's asking and why. So you do not release the patient record to anybody. The information obtained by the practitioner from a third party. Okay, now some information you may get from insurance companies regarding the patient. Okay, about the patient is not part of the patient's information, and as such information may have to be revealed on strict instructions of confidentiality. So those you cannot reveal at all, and if you reveal, it has to be under strict confidentiality. Okay, so this is about the ownership records. Now, if you want to transfer records from one facility to another, what you need to do is you need to provide a full clinical summary. Don't send the patient's full file. Okay, especially when you are transferring a patient from one hospital to another hospital, don't send the full file. Send in a clinical summary of the patient's management during his or stay in the first facility for Why? For continued care in the second facility without undue delay of new investigations or treatment plan. So essentially, we try to avoid any duplication of investigations which may eat up the patient's time and delay the management of the patient. So you don't do that. You provide a clinical summary. If you want to provide something, you can provide photocopies or full details of all the relevant results or investigations and radiographs. The original whole medical record shall be retained physically with the primary medical practitioner or the primary healthcare facility of the service. That means you will hold on to the original one and should be accessible to the referred second facility or the service if needed for continuing management of the patient. So sometimes we have carcinoma patients where he has been transferred to a higher facility. There you will transfer the patient and you can transfer the his complete file, but you have to retain a copy with you. Okay, the best option is to provide them with the photocopies of all the relevant investigations, all the relevant clinical notes. Okay, and you must retain the original one. So this goes in terms of transfer of the patient between hospitals, or when you are transferring your patient to another clinic. Okay, so maybe you are transferring your patient for care to other clinic, just send in a clinical summary. Okay, so typical example is when the patient gets discharged from a hospital after an operation, right? He has a discharge summary. Okay, if you want details, the hospital send you the photocopies of his investigation, but they will never send you the original copies of the investigation. So this is how the protocol. Okay, now the last part is who has the access to the records, who can get the records. Okay, now remember, the record is the intellectual property of the doctor or his healthcare facility. The patient is though entitled to access their records for various purposes, ranging from need to seek second opinion, very very important, to seek further treatment elsewhere, or of course for litigation, for suing you. So they are entitled to access their records. So how do you do that? Okay, so first and the foremost thing is that you cannot object as a healthcare provider. You cannot object to the release of results and the reports of the patient investigations, x-rays and scans, and other diagnostic tools which the patients have paid for personally or through insurance. So remember, we talked in the earlier slide that these can be released to the patients without any problem. Okay, now for the medical record per se, the medical practitioner and the person in charge of the healthcare facility and the services are expected to cooperate and release all parts of medical records or certified true copies of the records when requested by the patient. So if the patient requests for a copy, you should cooperate and release your medical records. Okay, and you should do this with a lot of confidence and that your record keeping practices are up to date, up to the standard. So you should not be hesitant to share if the patient seeks access to his records. Okay, and if you say no, cannot give you, the patient may then resort to a civil action suit if you deny access to their patient records. So they can go to the court and ask legally for the records. Okay, so that is why it is very very important that we should have full confidence in our record keeping practices, the way we write records, the way we maintain records, that anyway you share it. Okay, not gonna harm you in any ways. All right, so this brings us to the end of this lecture. These are some of the resources that I have pulled up to prepare this lecture. You are most welcome to go and read more on this. Excellent stuff here, and I hope that you have uh, picked up some important pointers regarding clinical documentation. Of course, it is not very easy to change habits, right? But we have to initiate somewhere. We have to start somewhere. Then only the habits will change. We tend to follow the habits of our seniors, and even though it is wrong, we just continuing it because that is the norm. Okay, so I want you to think about how you're writing your clinical records and start maintaining good clinical records. And when you start maintaining good clinical records, you get habituated to writing good clinical records, and then this comes automatic to you. So whether you are in Malaysia or in UK or in Australia, you already have a good sense of record keeping and writing good clinical notes. Okay, so you'll be very welcome in any professional practice. All right, so okay, so this brings us to the end of today's presentation, today's session. I would like you all to take 5 minutes, close your eyes, and just try to remember the main headings that we have used in this presentation. And this will help you to, make memory boxes, small memory boxes in your head which you can easily put in more information when you read these slides later on. So that is a very good habit of learning. So give yourself 5 minutes to recapitulate the main headings, and I would also like you to reflect upon the learning objectives of this topic. And if you need more explanation of anything, you are most welcome to reach out to me in the clinics. I'll be very glad to help you out. All right. So that's it for this session from me. This is Dr. Fawaz Siddiqui, and we hope to see you in the part 2 of documentation. All right. Take care and have a good day. Bye bye.